Well, universal health coverage is the first priority of Dr. Tedros, and he has actually said it many times. And universal health coverage is really at the core of what we're doing in WHO. And the definition is really all people and communities having access to quality health care whenever and wherever they need it without financial hardship. What our analysis shows is that universal health coverage is both technically and financially possible. This means that we know what kind of services make a difference in the life of people, and we know that some countries manage to deliver them even at low levels of income. Some countries are doing better than others, and that's been the case for a long time, that some countries do better in terms of providing services for their people at low cost. But we also know that, within the next 15 years, resources will be available. Economies are growing, governments are strengthening, and that more than 85% of the cost of universal health coverage could be funded domestically. So there will be still some need for external finance, for aid for health to invest, particularly in the very low-income countries. But generally, most countries can fund it on their own resources. So what does it say? It says that if it's technically and financially possible, then we remain with politics. And that's why in WHO we have this program that is called the UHC Partnership. And this program really is about strengthening the capacity of countries, the technical capacity, the policy capacity, the political capacity to both design and implement programs that will lead the country to reach universal health coverage. And that involves, for example, strengthening budgeting for health, making the case for good investments in healthcare, but also strengthening the national conversation to have citizens' platforms such as national health assemblies, in which all the stakeholders, private sector, public sector, citizens, patients, health providers, can have a national conversation about what kind of health care they want and how it will be financed. There are a lot of complex technical issues. Universal health coverage is not an easy technical issue, even if we know how to do it. We know that in most countries it's an unstable equilibrium that you constantly need to attend to and to nurture. So this is where really developing the capacity and developing the institutions is the big challenge. This institutional strengthening part is really important. In many ways, we still don't completely understand how institutions are built. So what we're trying to do is really foster this national dialogues as well as this exchange between countries to see that how did countries who do well do it, so that a country who is trying to improve its coverage with health services and design a program for universal health coverage can learn from different models, different countries, because we know there is not only one route. There is not only one road to universal health coverage. There are several potential pathways.